What are some of the treatment options that are even available, and what are the differences?
So the things most people are familiar with, and probably the main things worth talking about without getting into the hyper nuanced, either research chemical territory or things that are in the pipeline to be developed but don't yet like technically exist in like the actual marketplace. I would probably say the main things to look at are that you could get an over-the-counter like anti-androgenic shampoo, which, you know, like a ketoconazole shampoo, for example. Again, very, very mild, not going to be the needle mover in a protocol, but it's over-the-counter, essentially side effect free, and everyone uses shampoo anyway, so you might as well get one that does something. That's something that has like some evidence for some level of impact, all but not going to protect most people entirely. But for some people with like very minimal propensity, they might be able to offset it with just that, but unlikely. The things that really move the needle are, of the over-the-counter treatments, Minoxidil, which is the only growth stimulant that's FDA approved that actually really hits hard and works. And while it grows hair, it doesn't actually prevent androgenic alopecia from continuing. That DHT is still wreaking havoc on your scalp, regardless of the fact that you're stimulating growth. The stimulation of growth is only offsetting the cosmetic representation of loss via the new hair or the prolonged growth phase of increasingly healthy hair that's being supported by minoxidil, but you're not preventing the further miniaturizing of hair follicles from androgens, DHT. So you might think you're preventing loss with minoxidil only, you're not. The analogy I like to give in my content on YouTube is you're in a canoe trying to row against a current, essentially. There's a stream and you're trying to row against the current, and minoxidil is you trying to like row forward, working against the current, which is DHT. And what you want to do is ideally get the current to stop raging against you and go to just calm. And then you can row up the current and actually make ground back. So you need to stop the further loss, ideally through the androgen manipulation, if you want to go that route, should it be warranted and you are willing to take on the risks, you know, and the side effect burden potential. But actually getting a regrowth is facilitated through the minoxidil. And if warranted, if you're a non-responder, there are other strategies that can be implemented to convert you to a responder. And that's where, you know, the nuance of interpreting this stuff through a company like Marek Health, if you are a non-responder, like what do you do? Are you just screwed? No, like there's things you can do like microneedling I've talked about at length on my channel. But in addition, something that I've talked about, all but not as elaborately, is tretinoin compounded with minoxidil to enhance something called sulfotransferase enzyme activity, which is the enzyme that converts minoxidil to the active minoxidil sulfate. Some people with low enzyme activity on their scalp don't actually get the adequate conversion to the compound that imparts the effect you're seeking from a growth stimulation standpoint. So getting a compounded product through a pharmacy that is able to make a minoxidil plus tretinoin formulation could convert somebody to a responder that otherwise didn't, even with the minoxidil plus the microneedling. So there are things that can be done. It just needs the nuanced interpretation and educated assessment of like, what are the most progressive treatments and what does this person need? And then from actually stopping hair loss, you know, that's where you get into the inhibition of DHT primarily. And that's Finasteride is the main go-to therapy for that. And it's tried and true, works incredibly well. And there is some risk of side effects, but that is where having a very candid conversation with your medical provider, if it's right for you, and what the real risks are, because the data is, I think, pretty clear as to what your probability is of risk, the likelihood of if you have a side effect, if it's going to go away, how long it will take. Like these are all things pretty clearly elucidated in the literature that in general represent what a fair probability is of all of each scenario, probability of each thing occurring, whether you're going to have benefits with no side effects, benefits plus side effects, no response plus side effects, and then you come off of it, how long it takes to restore. Like all that stuff is very clearly elucidated in the literature. And there are fringe examples of people who have outlier responses, but just like any drug, there are very extreme responses to some drugs. And that's just part of what comes with the territory with some of these, with pharmacology, unfortunately. But ultimately, like for me personally, I use Dutasteride, which is the nuclear version of Finasteride essentially. And I know for sure I would be very bald right now had I not implemented it years ago. So, you know, for me, it was worthwhile. You know, obviously it could change over time, who knows? But at least to me, I have not noticed any side effects to date. And it's been a net positive in my life. Now, obviously that could differ for certain individuals, and that's where talking to somebody candidly about the viability of it and if you're a good candidate is worthwhile and a important conversation to have with somebody who knows what they're talking about. Marek Health is exceptional in their knowledge when it comes to hair loss prevention and the assessment of the who's a good candidate versus not, and what therapies would be worth actually pursuing versus not. So when it comes to the most efficacious treatments in general, on the pharmaceutical side, it's going to start with finasteride. And then if you need to increase the intensity of DHT reduction to actually get a even greater effect, or you're not responding to finasteride after 6 to 12 months, that's where Dutasteride might be worthwhile. And there are new emerging technologies when it comes to anti-androgen therapy topically and androgen receptor degraders that we could speak to, but I think it's probably outside the scope of this conversation, where the main things that hit the heaviest and have the most data to back their efficacy and safety profiles: finasteride, Dutasteride on the DHT manipulation side, and on the hair stimulation growth side, Minoxidil, microneedling, tretinoin to enhance the capacity of minoxidil to convert to minoxidil sulfate, and over-the-counter shampoo, basic stuff like ketoconazole, whatnot. That's kind of the bread and butter of most protocols.
And with the minoxidil, that's a topical, and then Dutasteride and finasteride, or a tablet, a capsule.
Yeah, so when it comes to minoxidil, there is more awareness being brought around oral minoxidil, which existed as like an outdated, really terrible antihypertensive drug, which was repurposed for hair growth topically when they found that people were growing hair everywhere, essentially, when they took it orally for blood pressure lowering. And while it works maybe better orally to some degree, it seems like the likelihood of side effects is higher by a fair degree. In addition, the level of efficacy that it has over topical is mixed in terms of if you're likely to get a significant upside on using it over topical. I think a lot of people are quick to jump to oral because they think it's going to be dramatically better, but they have not yet tried actually ensuring their scalp environment is actually healthy, that they're absorbing it properly, haven't tried microneedling, haven't tried the tretinoin, etc. Once you've tried all those things, it might be worth considering, but it has a black box warning on the drug, and it is what appears to be a higher side effect profile, or a far more risky side effect profile than topical minoxidil, which has hordes of literature supporting its safety and efficacy concurrently with very, very impressive before and after results, especially when coupled with the other adjuncts that I mentioned. But as far as the pharmaceutical side, finasteride and Dutasteride can be used topically, all but it seems like oral is the best for achieving not just adherence, because it's at least easier to adhere to taking a little pill every day than applying something to your head, but the upside you get from localized activity and like lack of systemic activity that people purport from finasteride doesn't actually play out in practical application. It seems like you still get the same systemic DHT reductions, just with the annoyance of having to apply it to your head. So I don't know if it's worth using either topically. I think oftentimes it is assumed that it's going to be safer, similar to the topical minoxidil, but there's no data to support that really. When you look at the actual breakdown of systemic levels, the finasteride will suppress your DHT just as much ultimately once it absorbs in a similar manner. And topical Dutasteride, there's some interesting literature on mesotherapy of it and injection into the scalp with it and things of this nature. But in general, oral seems to be the go-to for most people when it comes to 5-alpha reductase inhibition through finasteride, Dutasteride. The thing that sucks about hair loss, more or less the actual scalp infrastructure has a permanency of deterioration once you let it get to a certain point. So after hair follicles are miniaturized, like these are literal organs on your head. And after they get to a certain point, you can only make up so much ground once you actually become aware of this and take it seriously. Proactive approach is the way to go. You don't wait until you're basically bald to then take it seriously, because at that point, even if you did the full-blown protocol, you probably need way more intensive of a drug protocol just to get back to what is otherwise a suboptimal level of hair still than you would have if you just took like a very benign, low dose, entry level approach to hair loss prevention from day one and took it seriously. It's tough because it's an area that ultimately is essentially unresponsive to lifestyle and diet, but it's also hard to tell somebody like proactively, like just get on drugs, bro. But like when it comes to hair loss, if you care enough about it and you're predisposed to it, which most are, you almost don't have any choice other than if you want to go the cosmetic route where you just get like transplants every time you want to gain back ground. You use like, I don't know, masking techniques to like make it look thicker. You get a wig, like, I don't know, like whatever you want to do with that.